Good evening, everybody. I'm basically going to be talking about the procedures that we do in the OPD on a regular basis. It could be anterior and posterior segment, contact and non-contact, and what precautions we need to take as doctors when we are doing these investigations. So from that point of view, the first and foremost would be that we ourselves wear the masks, wear the goggles and the shields whenever it is feasible for whichever of the procedures. PPE is not mandatory unless I think the patient is COVID positive as of now. We also have a shortage of the PPEs. Second point that I would like to come to is the multi-dose eye drops that we use in our OPD, whether it could be dilating drops or the topical anesthesia. I think we're all using them in our OPD. So how do we go about instilling these drops is have a designated staff to do it. And ideally, like always, do not touch the lashes or the ocular surface. Each and every post every patient, the concerned personnel should disinfect the hands after every patient so that when you touch the next patient, the virus is not carried forward if there is one. Third point being that there should be no aerosol generating procedures being done unless absolutely required. These could be the air puff, it could be the syringing, NCT, whatever else that we're doing in our OPD, which can generate aerosols should be completely avoided. I think we all use slit lamps and we use our indirect ophthalmoscope. So we should be using a breath shield for that. Existing small one is not adequate. We need to make one at least of A4 size. And once that is installed, I think it will be easy. And one should remember that the patient side needs to be cleaned frequently because every time an aerosol is generated, again, that is going to become unsterile. We need to put it in between the oculars and the patient, and then it's relatively safe. The same can also be used for the LIO, which is the preferable method for laser rather than the slit lamp delivery. Coming to tonometry, the tip and the housing can come into contact with the patients when we're checking the IOP. Again, try to use disposable tips or use 70% alcohol to sterilize in between. Indirect and slit lamp, comparatively, indirect is better, again, with the shield. There are a lot of videos where it shows us how to put these shields. And LIO delivery is preferable. Avoid contact procedures whenever possible. Most of us have wide field imaging. If possible, let's just make do with imaging and again use barriers for all these investigations. So these are some of the points in the OPD when we're doing procedures. And I think it kind of gives an overview of the SOPs once we start back post-lockdown. Thank you.